how does your testosterone level or testosterone replacement therapy affect your risk of developing prostate cancer? I get this question all the time when it comes to TRT or when it comes to your testosterone and whether it's associated with the risk of prostate cancer. So let's talk about the correlation between testosterone, testosterone replacement therapy, and prostate cancer. So a lot of the confusion around testosterone and prostate cancer comes from some old studies back in the 1940s, in fact, in the urology literature. There was a study by a Dr. Huggins from 1941 that looked at men with advanced metastatic aggressive prostate cancer. And what they found in these men was when they castrated them, either by removing their testicle or giving them estrogen, what happened was, in these 8 patients, their serum acid phosphatase levels dropped dramatically. Now, back then, there was no PSA yet, so serum acid phosphatase was really the best way to assess prostate cancer and prostate cancer behavior at that time. And so in these men with advanced metastatic disease, castration did, in fact, suppress the cancer. And when they gave these men testosterone, the serum acid phosphatase levels increased. And so what that told us is that prostate cancer is a hormone-sensitive type of cancer. It relies on testosterone to grow. However, there's some nuance around that we'll get to in a moment. What he said was prostate cancer is inhibited by decreasing androgenic hormonal function. Again, that means that castration will suppress prostate cancer growth. The key here is that these men had metastatic prostate cancer, advanced throughout the body. Not quite the same situation, not quite relevant when we're talking about the normal population giving testosterone. Does it actually cause cancer? So the key distinction here is advanced aggressive cancers, yes, those respond to those respond to testosterone. So aggressive metastatic prostate cancer, yes, it responds to testosterone. However, is there a correlation between your testosterone levels and the risk of actually developing prostate cancer? That's the key question. And several studies look at this. This study from Abe Morgentaler from 2006 looked at 345 men with low testosterone, hypogonadism, and they all underwent a biopsy. And they found that 15% of these men developed prostate cancer. And that's about what we know. About 1 in 7 men will at some point in their life develop clinically relevant prostate cancer. The odds ratio, what this means is the likelihood of developing cancer in the low T group compared to the high T group was 2.26. Put another way, that means that men in the lowest testosterone level group had a 2.6 times higher or increased risk of developing prostate cancer compared to the men with a high testosterone. Absolutely opposite of what we would expect, right? Low T is associated with an increased risk. Another study, this one comes out of Korea, and this one looked at, again, does testosterone level predict your risk of prostate cancer? This one looked at 568 men who underwent prostate biopsy, and again, they found that men with low testosterone had a significantly increased risk of developing prostate cancer. The odds ratio was, again, around 2. That means, again, men with low testosterone have about twice the risk or twice the likelihood of developing prostate cancer compared to men with higher testosterone levels. Another study here from the Journal of Urology in 2000 looked at 117 men with prostate cancer, and they found that men with low testosterone had more extensive and more aggressive disease compared to men with higher testosterone levels. Another study, it looked at 455 men who underwent surgery for prostate cancer, and again, men with lower testosterone levels had a higher grade, more aggressive prostate cancer on final pathology. Now, here's another study that looked at this question. It compared 222 men with prostate cancer compared to 390 men without cancer. And in this study, there was no association between the testosterone level and their risk of developing prostate cancer. However, when they corrected for it and looked specifically at the free testosterone, which we know is much more important and relevant, right? Then there was a strong trend of increasing prostate cancer risk in men with low free testosterone. So again, same story in a different way. Now, this was a powerful study. It was the REDUCE trial, and this was looking at the effectiveness of dutasteride for preventing or reducing the risk of developing prostate cancer. But what they did in this study is they took specifically the placebo arm of that trial, meaning men who did not receive the drug but were simply being followed. And these men, 3,255 men, underwent biopsy, a great population to assess in relation to their testosterone levels. And in this group that they found, what they found was that baseline testosterone levels were not associated with the risk of developing prostate cancer. So again, this contradicts the other studies that suggest that low testosterone is associated with an increased risk. That's fine. The key point here is that all of these studies told us the same thing, and that is that high testosterone levels have absolutely no correlation with an increased risk of developing prostate cancer. And in the first few studies I shared with you, lower testosterone level was associated with an increased risk of developing cancer. Key point there. Any correlation between giving testosterone replacement therapy now and the risk of developing cancer. So now we're not looking at your basal levels of testosterone. Now we're looking at, if we give you testosterone, does it increase your risk of developing prostate cancer? This is probably one of the most common questions I get, and it goes back to all the confusion that we got from that study in 1941 by Dr. Huggins. Many studies have looked at this question. This one here from 2014 looked at over 1,000 men with low testosterone who received testosterone replacement therapy. They followed them for 5 years, and they found that testosterone therapy did not increase the risk of those men developing prostate cancer. Now, some limitations of the study, to be fair, there was no control group and a fairly short follow-up time of just 5 years. Nonetheless, again, no increased risk of prostate cancer in the men who received testosterone replacement therapy. Another trial looking at the same question, prostate safety events during testosterone replacement therapy. This is out of JAMA. This was a randomized trial of 5,200 men with low testosterone. The endpoint was simply whether they developed high-grade prostate cancer or not. And after 14,000 plus person years of follow-up, there was no difference in the risk of developing significant prostate cancer in the men who received testosterone replacement therapy compared to those who did not. Again, put another way, TRT did not increase the risk of developing prostate cancer. There was also, interestingly, no difference in the risk of developing any lower urinary tract symptoms, prostate symptoms, bladder symptoms, or any complications. But what they did find, and I see this in my clinical practice all the time, and that is that men who receive testosterone replacement therapy, we do see a slight rise in PSA. So there was a greater PSA increase in the men who were followed who had TRT compared to the ones who did not. But the key point here is it's not from cancer. And I talk about this in other videos, that PSA is a great screening tool for prostate cancer. However, it's flawed by the fact that there are a lot of reasons why PSA can be elevated other than cancer. Prostate enlargement, prostate inflammation, prostate infection, urinary retention, other issues like that that can cause PSA elevation, not necessarily cancer. And again, the point here is that TRT did not cause increased risk of cancer. How about men who have been treated for prostate cancer already? Are they candidates for testosterone replacement therapy? Well, this is some interesting cutting-edge science here. This study looked at 100 men who had low testosterone who were treated with topical testosterone after prostatectomy compared to 49 men with low testosterone who did not receive testosterone replacement therapy after surgery. After 2+ years of follow-up, there was no increased cancer recurrence rate in the men who had testosterone replacement therapy. Now, some limitations here, some flaws of the study, to be fair. Retrospective, small group. It's not clear what the testosterone levels were achieved on the topical testosterone. And so take this study with a grain of salt, but it certainly shows that it's possible that in some men it may be safe and reasonable to receive testosterone replacement therapy after treatment. Another study looked at 13 men who had radiation treatment for prostate cancer, who had low testosterone, and they were given testosterone replacement therapy. After 2.5 years of follow-up, again, no increased incidence of prostate cancer recurrence in this group. Study flaws again, retrospective, small cohort, suboptimal T levels, in my opinion, were achieved in this group. But nonetheless, this sets up the position that it is possible for some men who have low testosterone, they've been treated for cancer, PSA is now negligible if they've had surgery or low if you had radiation, and you seem to be cancer-free, and in those men, it may be safe to receive testosterone replacement therapy. I would definitely point out here that this is cutting edge. You need to talk to your doctor, and this does not apply to every man. This is a great comment that comes from the urologic clinics of North America that I think is worth emphasizing here. The quote, which came from Dr. Lipschultz, is, if we do not lower testosterone levels of eugonadal men, which means men with normal testosterone levels, after radical prostatectomy, after surgery for prostate cancer, how can we justify not replacing testosterone in men with low testosterone, in hypogonadal men, to make them eugonadal following a radical prostatectomy? Great question here. The point is, we don't typically castrate men or turn off testosterone if we've done surgery and the cancer seems to be gone, the PSA is low. Castration therapy is really only for men with metastatic, widely aggressive cancer. But for men with locally confined disease, have had surgery, have had radiation, if we don't castrate them to lower them, why is it not appropriate to bring their testosterone levels up to where they're supposed to be? We're not talking about making you a Superman. We're talking about making you a man again. And so this drives home the point that it is worth consideration in certain men who have been treated for cancer to consider testosterone replacement therapy. How about TRT for men who actually have prostate cancer? Untreated, non-aggressive prostate cancer. So we call this active surveillance, where men with grade group 1, it was previously called Gleason 6 prostate cancer, they're on active surveillance. You're being followed closely with periodic PSA, maybe MRI, maybe repeat biopsy. Cancer is not progressing, and we know that in those men, the harms of treatment outweigh the benefits. And so what about those men who have low testosterone? Can we give them TRT? Well, there's actually studies that look at this as well. There's a great study from Abe Morgenthaler's group, again, looked at 154 men on active surveillance for low-grade prostate cancer. And again, active surveillance means we're closely monitoring the cancer without actual treatment. And the way we evaluate these men, what's called reclassification, is, does anything change about the cancer that makes us now say, look, you're no longer a candidate for active surveillance. You now need treatment. Follow-up biopsy, follow-up MRI, follow-up PSA. Something has changed to the point where we now say it's not a reasonable course of action to continue to follow it, and we now recommend treatment. So the question is, how many men who receive TRT do they undergo reclassification, meaning we find that the cancer has progressed? And the answer is, men with low free testosterone levels at baseline have a higher risk of reclassification. That means that men with low free testosterone are much more likely to end up needing cancer treatment in the end. Also, men with higher free testosterone levels had a lower rate of reclassification. So this compares to the studies we talked about earlier, that men with higher testosterone levels tend to have less aggressive disease, and that showed up in this study as well. This study looked at giving testosterone replacement therapy to men who have prostate cancer. 149,000 men with low-grade prostate cancer underwent testosterone replacement therapy, and they were followed for 8 years. And what they found, amazing, was that in the men who received TRT, the risk of cancer progression, the risk of cancer-specific mortality, the risk of overall specific mortality were higher in the men who did not receive TRT. So again, men who received TRT, lower risk of mortality, lower risk of cancer progression. So TRT did not increase the risk of cancer progression, is really the answer to this question. Is TRT safe in select men who have untreated, indolent, non-aggressive, low-grade cancer? It is possible. Again, I want to caution you listening here that this is cutting-edge science, and I would definitely work with a doctor who understands this stuff well, and this does not apply to everybody. So what do we know in summary here about the relationship between your testosterone level and testosterone replacement therapy as it relates to your risk of developing prostate cancer? We know that lowering testosterone is a common and effective treatment for metastatic prostate cancer, like the Huggins study from 1941, but we know that low testosterone is likely associated with an increased risk of getting aggressive cancer, and that TRT does not increase your risk of developing cancer at all. And in fact, TRT does not increase risk of cancer recurrence in those who have been treated. TRT may actually, in fact, be safe for men with low-grade prostate cancer untreated on active surveillance. I want to again emphasize this does not apply to every man. TRT is not suggested for men with recurrent or metastatic disease. If you've had castration therapy, it's called androgen deprivation therapy. That may be Lupron, Trelstar, medications like that from your urologist or radiation oncologist. This does not apply to you. The science shows that it's a different situation at a biologic level if we were to give testosterone to a man who has had castration therapy previously. TRT is still considered experimental, and you need to weigh the risks and benefits. Again, work with a doctor who understands this stuff, because this needs to be done carefully. More high-quality long-term studies are needed to fully understand the relationship between testosterone and prostate cancer, but it appears that in men in the general population, testosterone replacement therapy does not increase your risk of developing prostate cancer. Regardless of your cancer history, close follow-up is always critical, always recommended. So I hope you found this helpful. If you're ready to optimize your health and performance and really understand how testosterone relates to prostate cancer, check out gapininstitute.com/launch for a bunch of peak performance gifts and learn more about our precision medicine approach to men's health optimization and longevity. Don't forget to hit the like button below, subscribe to this channel for more evidence-based insights on optimizing your health. I appreciate you watching. I'll see you in the next video.